Tonight we have Dr. Mitzi Williams, and Dr. Mitzi Williams will be speaking about exploring diversity in the multiple sclerosis community. And this program is sponsored by Genentech. And after Dr. Williams speaks, we will then have a Q&A. And I hope to see more people online during the Q&A. And then we'll get questions going, all right? So Dr. Williams, I know you'll be presenting for about 35 or 40 minutes, I think you said.
Absolutely.
All right, great. And we look forward to coming back on and chatting with you afterwards, okay?
Awesome sauce. Well, let's get the party started. Happy, what's today? Tuesday? I don't even know what day it is. Happy Tuesday, everybody. Thank you for those of you that are logging in. And for those of you that will view this afterwards, we're excited to have you view the information too. So I am Mitzi Joy Williams. I'm a board certified neurologist and fellowship trained MS specialist. And I am located in Atlanta, Georgia, which is a little cold this time of year. Well, cold for us. So very excited that Stuart invited me to talk about a topic that's really important. And we're going to talk about kind of a hodgepodge of things tonight, but we'll start by focusing on diversity in MS and underserved populations. We'll talk about your healthcare team and how you can participate in shared decision making, and then we'll round it all out with a little bit about brain health. So I'm always about what you can do to help yourself. And so we want you to leave this program feeling empowered to take control of your health. All right, so first slide I like because multiple sclerosis is so many things. So when we think about it, certainly there's a clinical definition, which your neurologist gave you. We talk about the myelin sheath, we talk about, the nerves, we talk about damage to those areas, inflammation, but it's so many things. And you can see this picture, this graphic, which is in the shape of a brain, if we saw the whole thing, has so many different words in it. There's inflammation, cognitive, pain, problems with the bladder, all kinds of symptoms. There's just so many different symptoms and ways that MS presents itself and shows up in people's lives, and so many ways that it can interrupt or change a person's state from before they were diagnosed to after they were diagnosed. All right, so the next question becomes, who gets MS, right? So we think about that clinical definition of multiple sclerosis, the autoimmune disease, that affects the central nervous system where the myelin is damaged and results in different symptoms. But one of the biggest things, one of the biggest challenges is identifying who has MS. Our tests and our ability to diagnose it have gotten extremely better. However, one of the current challenges is recognizing that many different populations of people do get multiple sclerosis. So traditionally, when I was coming along in my training, which makes me sound a little bit old, I guess I'm dating myself, there was a certain picture that we had in mind when we thought about multiple sclerosis, and that was a picture of a young woman of Northern European descent. And so when we look at MS across the world, the highest risk of MS is still in Eastern Europe. However, here in the United States, there is a lot of MS. There's estimated nearly 1 million people living with MS in the States. And what we're finding is that really anybody can get MS. And we're finding that there are higher numbers or percentages of folks with MS in different ethnic populations, such as the Black and African American population, the Hispanic population. So a lot more people are getting MS from different groups in that original category and thought that we had in mind. So it's important for us to be able to identify this, and just to make sure, particularly from the healthcare perspective, as well as from patient perspective, if you're having symptoms, MS is not excluded just because of how you look or what your background is. Anybody is susceptible and could possibly have multiple sclerosis. So we need to make sure that's getting checked out. When we talk about, marginalized populations, these are groups, again, that may be under-recognized or may have specific challenges that may affect their ability to receive care, as well as particularly their ability to be diagnosed appropriately. So marginalized populations may be different depending on what part of the world you live in. When we think about marginalized populations here in the United States, certainly some groups are racial and ethnic minority groups, so Black and African Americans, Hispanic, Latino Americans, Asian, Native Americans or American Indians often are considered marginalized populations because they are minoritized. And minoritized means in this part of the world, they are minority or smaller groups, but in other parts of the world, these populations may be the majority. Okay, so this is kind of specific to the US. Other marginalized populations, though, which are really important to highlight, are people who are immigrants, right, who come from other places, those who may be a part of the LGBTQ community, those who may be part of the trans community, those who may have mental illnesses, as well as those of lower socioeconomic status, those who may be older. There's a word on this slide called senior citizens. I don't know that I like to use that word, but certainly those that may be older. And for the purpose of MS, most of our research stops at the age of 55. So literally 55 would be considered older, which in the real world is not. So there are many marginalized populations that we need to make sure that we're treating appropriately, and that we're also making sure that we're bringing to the forefront the issues that may occur in these populations so that people can be treated appropriately. So let's kind of take a 50,000-foot view and talk about health disparities. If you've ever heard me give a talk about this topic, I talk a lot about health disparities. So health disparities basically means there's a difference in outcome, right? Usually negative, but it is not based on characteristics of that person's disease, meaning MS symptoms, the way it starts may be the same in people of different backgrounds, but one person has a poorer outcome, not because they need something different, but because of multiple factors that lead to them not getting the care that they need or getting inappropriate care. So there are many factors that lead into health disparities, and we know that these absolutely negatively impact health outcomes. So it's important for us to recognize, but also to try to address these health disparities so that we can make sure that everyone is able to have equal access to treatment and equal access to quality treatment for their diseases, whether it's multiple sclerosis or any other condition. All right, so what are we really talking about? When we talk about health disparities, usually we also talk about health equity, right? And so this is an illustration that I like that kind of illustrates the difference between equality and equity, right? So some would say, well, we give everybody the same thing, so we should all have the same results. But as you can see from this illustration, we have people who are different heights, right? And different colors. But we have people that are different heights. And so if we give everybody the exact same thing, there's still the person on the end that doesn't have access, right? That person can't see. Versus equity, where we give everybody what they need, right? And so each person has something different, but now they all have the same view or the same access to be able to see the field, right? And this is an analogy for ability to be able to access care. So really, when we're talking about health equity, we want each person to have what they need to be able to have the same type of access to quality care and outcomes. So what affects health equity and what affects health disparities? One of the biggest things that affects these different outcomes is what we call social determinants of health. Social determinants of health have really come to the forefront in the past 5 or 6 years, particularly since COVID, where we're talking about what are some of the things that lead to people having some good outcomes versus those having outcomes. And we saw that very clearly with the pandemic, where some communities had a lot higher mortality and death rates. And it wasn't because their disease was different, right? It was because of these other factors. So social determinants of health are the conditions in which we live, grow, work, play, and age, right? Some of them are modifiable, but some of them are not, right? So included in those social determinants certainly is economic status, right? If someone has a lower socioeconomic status, they may not be able to pay their copays or, pay for parking at certain facilities, or even have access if they do not have insurance or if they have insurance that doesn't cover a whole lot. Also, when we think about education access and quality, this is important because someone's educational level could contribute to their ability to understand instructions with medications, as well as to seek out different specialty care, et cetera, if those things are not offered to them up front by their primary care physicians, et cetera. Also, healthcare quality and access is extremely important because, particularly with a disease like multiple sclerosis, having access to specialty care is becoming more and more important. As our treatment landscape has changed dramatically over the past 10 years, there are now many different types of treatments that have certain side effects, and MS specialists are generally on top of these types of issues and able to address them and address questions appropriately. Whereas some people in the general neurology community, there are many amazing general neurologists who treat MS, but there certainly are some who are not aware of newer treatments and therapies and research. So the type of healthcare access you have, as well as the quality, can make a really big difference in your healthcare outcomes. Also, your neighborhood, right? When we talk about multiple sclerosis, we'll talk a little bit later about brain health, right? And things that help brain health are things like exercise and movement, as well as diet, right? If you live in a neighborhood where it's not really safe to exercise, that can affect your ability to exercise, or if you don't have transportation or the means to get to a gym. Also, when we think about, other comorbid conditions or other conditions that can affect MS, like high blood pressure, diabetes, etc. If you don't have access to healthy foods in your neighborhood or a good grocery store, that can make a difference in your health outcomes. And then, of course, social and community context, because we know that MS is a disease that affects the central nervous system, but many people do suffer with depression, anxiety, also isolation, depending on their level of ability or level of disability. So having that social interaction also makes a big difference in outcomes. And all of that to say, there are some studies that suggest that social determinants of health can determine your outcomes by more than 50 or 60%, meaning that these factors can influence your health, sometimes even more than the medications you receive, right? So these are really important for us to pay attention to and to try to make sure that we are incorporating solutions to, if there are negative impacts in the treatment plan that you and your neurologist or your MS specialist come up with together. All right, so just a couple of studies. I'm going to breeze through these because we've talked about, I've talked about these before. If you've seen programs like this, I'm sure Stuart has everything cataloged on the YouTube channel. But there are a couple of studies that I'd like to highlight that talk a little bit about health disparities and inequities in the multiple sclerosis population. This was a review study by my good friend, Dr. Liliana Amescua, that basically talked about the fact that socioeconomic status, your income level, can impact care for Black and Hispanic people with MS particularly. There also are multiple studies that show that there's higher progression, there's higher mortality, and higher morbidity or disease burden in these populations. The low representation in clinical trials affects our ability to adequately treat our underserved or underrepresented populations because we don't have the data or information to really support understanding why we may see worse outcomes or why we see certain outcomes in one population versus another. And then, of course, there's a big impact of systemic racism and other forms of discrimination that can affect these social determinants of health as well as healthcare outcomes. All right, this is another study, a chapter actually that I was very fortunate to co-author with several of my colleagues, and we talked about multiple sclerosis. Again, some of this information we have discussed, that MS occurs in much higher percentages in underrepresented populations than we previously thought. And of course, these social determinants of health can have a really big impact on outcomes, but we really don't understand the impact of social determinants of health as well as maybe biologic factors that may be leading to worse outcomes. And that's because we need more research to help us understand. And so there's a lot of work that needs to be done, even though we've come a long way, to basically help us understand how to address different barriers to care in populations and how to make sure that we're treating everybody equitably. This is another study that I was a part of that looked at healthcare outcomes for pregnant women with MS, and they looked at different pregnancies and found that Black women had a higher risk of having an emergency C-section, and that babies that were born to underrepresented women had lower birth weights and shorter breastfeeding duration, which could possibly affect the long-term outcomes of the infants. All right, so, all of that to say, we do have some data that suggests that certain populations may have worse outcomes, but it's very complex and there's a lot that we don't understand. What are some of the barriers that we see to care in certain populations? Certainly some of the things that we've mentioned, such as systemic racism, as well as bias and misdiagnosis. Again, people are looking for that certain picture of that young European woman with MS and may not look at the young Black man or the young Asian man, or, the Hispanic Latino woman, et cetera, who may have the condition. Also, there may be a lack of access to culturally competent care. And so some people get discouraged. If you go and participate in the healthcare system and try to get care and have a really poor experience, you may not want to go back, and that may lead to higher disability as well. Also, we have, as I said, a lack of data to help us understand why we see these different outcomes in populations. There is distrust of the healthcare system because of previous events, when experiments were done that were not ethical. People do have a memory of some of those things, but also it's people's current interactions with the system, right? So these are not just historic occurrences. When someone goes to the doctor and they're not believed, or they are told that they have a psychiatric issue, and it eventually winds up being a disease like multiple sclerosis, it can cause them to be distrustful of the healthcare system. Also, we need diversity amongst our healthcare providers, right? And then, of course, economic factors such as lack of insurance or underinsurance, as well as for those who may be immigrants, language barriers or lack of translators may certainly affect outcomes in a negative way. All right, so I wanted to pause here and talk about something that we need to also better understand. So again, when we talk about underserved and underrepresented populations, certainly many people think first off racial and ethnic minority groups, but particularly with MS, there are many groups where we need better information. And so I love this picture about the lifespan. We've got a woman at the top and a man at the bottom. There's a lot that we still need to understand about pediatric MS, right? There are not many studies that are done in children, and rightfully so. But we need to understand how to best treat that. Also, as women are in childbearing ages, there's a lot that we still need to understand about pregnancy. Our knowledge has come a long way in terms of recommendations for medications, but we need to better understand issues related to pregnancy and breastfeeding. Also, menopause is another huge button. I was about to say hot button, and no pun intended, that we need to learn more about and how to treat our patients and how to treat those living with MS during this stage. And then finally, when we think about our older population, I'll put older in quotations because for the purposes of our studies, that's over the age of 55. And so that's relatively young. And so we don't know a lot about what happens with treatment with people in that population age range. And we don't know a lot about what we should do in terms of should we continue treating, should we stop treating? And there are many of my colleagues who are doing studies to try to help us better understand. But all of that to say there are many knowledge gaps that need to be addressed aside from just looking at just underrepresented racial and ethnic minoritized groups. So knowledge gaps, I kind of outlined several of these. We need to understand why certain populations seem to have more disability and why they have worse outcomes. We definitely need to understand how to best treat our pediatric populations, as well as our patients who are over the age of 55, pregnant and breastfeeding women, those who are going through menopause, and of course, making sure that we are appropriately treating those who are members of sexual and gender minority groups, and making sure that we have an inclusive environment so that people feel welcome and open to receive care and that they want to engage in the healthcare system because they're receiving good care. All right, so we'll pause here and talk for a second about clinical trials, which is one of my favorite topics. But clinical trials are extremely important. So when we say, hey, Dr. Mitzi, we have all these questions, gosh, we have all these knowledge gaps. How do we get to the bottom of these knowledge gaps and how do we better understand so that we can treat everybody with MS? Well, the answer to that is research, okay? There are many, many different types of research that help us to understand populations, but one of the main ways we understand is clinical trials. Our clinical trials are often the studies that are used to have medications approved. So many of them do involve medications or procedures, if we think about it in the general sense, but basically, everyone is receiving the same standard of care. So theoretically, we can kind of eliminate some of those social determinants of health barriers if everybody's getting the same type of care, and better understand if there are, if those are mostly the factors that are affecting outcomes, or maybe if there are biologic issues, maybe certain side effects in some populations that may be leading to these differences in outcomes. So, I'm a big advocate of people being involved in clinical research. Clinical trials are not necessarily for everybody, but everybody can participate in helping us better understand MS and helping the future folks with MS be treated better and more equitably. So there are clinical trials. There are also research databases. There are registries that involve questions. There are studies looking at diet and exercise. There are many types of different studies that are being done. And if you so choose, I recommend everyone, if they can get involved to some degree, please get involved, because it helps everyone that comes after you and potentially can help you in the short term, depending on the results of the study. And so we really have a need for improved research. All right, so what can you do, right? So Dr. Mitzi, all right, all that's good, all that's theoretical. Yes, we want to solve health equity. We want to do all of those things and decrease health disparities. But what can I do to help myself, okay? One of the things that I think is really important to decrease health disparities and improve health outcomes is to be empowered. So I am a big advocate of patient empowerment, and I know that Stewart and MS Views and News are as well, because they put on all these amazing programs to help you better understand different aspects of disease, and to meet with these experts and talk to them and ask questions. So let's go to what you can do. All right, number one, shared decision making. So this is extremely important. And one of the first parts of shared decision making is assembling your healthcare team, right? So again, in some cases, you may not be able to pick the first neurologist you see, but certainly I think it's important for people to be in spaces where they feel comfortable and where they feel like they are heard and listened to, So again, assembling your team. Your team consists of your neurologist, your primary care physician. Everybody with MS needs a primary care physician, regardless of how young or how healthy you are, because your neurologist does not want to look in your ears or your nose. And then also, you may need other specialists depending on the types of symptoms that you have. You may need a dietitian or nutritionist to help you. You may need a urologist, right? If there are issues with the bladder. You may need physical therapy if you're having issues with movement. So there are all different types of members that make up your team, and each team will look a little bit different. So I encourage people, if a relationship or team member is not working out, it's always okay to seek a second opinion, and you may find that you have a better fit with someone else. And being comfortable with your neurologist is important, because you tell them a lot of very personal things about yourself, and you want to feel confident in your shared decision making with them. All right, what about setting goals? This is also an extremely important part of your healthcare plan, right? And so your neurologist works with you, as well as your other team members, to set goals. Sometimes setting small goals is extremely important. And they also help you to kind of level set and say, okay, are these, what we think are realistic goals in light of where we are? What do we think we can achieve? And, what do we want to accomplish? And so that's extremely important, is to have goals, things that you want to accomplish or want to do, and to try to work toward those. So developing your treatment plan. These are some key components of developing your treatment plan and shared decision-making process. Number one, don't be afraid to ask questions. This is extremely important. I encourage people to write down your questions before you go to your doctor's appointment, so that you can make sure that your concerns are met. There's a limited amount of time. Your neurologist is going to make sure that they cover the things they need to cover. So you want to make sure that your top priorities are covered during your office visit when you have that face-to-face face-to-face time. Shared decision-making is key. So it's important to recognize that we are not in an era of paternalistic medicine where your doctor tells you what to do and then you go home and do it, right? We want you to do research. We want you to talk to your family members or those other people who help you with key decisions and come back and we make a decision together so that you're more vested in the plan. Have care partners, right? Come with you to visit. Sometimes they have information or have seen things that you may not be aware of, and they can help us to have a better picture of how you're doing at home. Also, take notes or have someone take notes so that you can remember what was said, and then understand your treatment plan to the best of your ability, as well as discussing what are the next steps and knowing who to contact if you have issues. And then, of course, don't be afraid to ask questions. So that's really important. If you don't understand, ask questions to try to understand to the best of your ability what you all are trying to accomplish, what the goals are of your treatment, and what to expect as the next steps. All right, so a couple things about brain health, which is also one of my favorite topics. I think that this is really cool because, the medical system or, generalized Western medicine is sometimes a little bit behind the 8 ball when we talk about things that you can do to improve your brain health. But this is something that's really come to the forefront in the past couple years. Number one is a healthy, well-balanced diet, which will look different for each person. The diet that's been most closely studied with MS is the Mediterranean diet. But I have patients who have been successful on a variety of diets. It just depends on which one you can stick to, right? But certainly the bottom line for most diet plans is more fresh foods, less processed foods. And then there are different spins on that. If you don't know where to start, a dietitian or a nutritionist could be very helpful to kind of help you get on the right foot. All right. Stress reduction or mental wellness, right? We're understanding a lot more about how stress can affect MS symptoms. A lot of my patients come in and say, hey, Dr. Mitzi, I know when I get stressed out, my symptoms are worse. So it's important to balance stress. Also, some of the symptoms of conditions like depression and anxiety can actually overlap with MS. So MS can cause fatigue, but so does depression. MS can cause sleep disturbance, but so does depression, right? MS can cause difficulty with concentration and multitasking, but guess what else does that? Depression. And so sometimes we'll have symptoms that are worse because we have other issues that are related to mental health on top of the MS that are not being adequately addressed. So making sure you're checking in with your physician. I encourage all of my patients at diagnosis and throughout the course of their disease to see a counselor or mental health specialist, and making sure that you're getting the help that you need to stay as balanced as possible is extremely important to your overall health and brain health. Movement, right? So exercise, some type of movement is important. There are multiple studies which have actually shown that exercise on a regular basis can decrease the rate that your brain shrinks or atrophies over time. And we know that brain atrophy is accelerated or happens faster in people with MS. So if there are ways that we can combat that with exercise, that's extremely helpful to try to, again, combat disease. So when we think about MS, we know that there's damage from the immune system. We also have this thing that we call a neurologic reserve, or our ability to bounce back. It's kind of like filling up your tank, right? That tank is automatically going to decrease a little bit over time as we age, but if we're doing things to fill up that tank, right, and build up that reserve, like eating a healthy diet, like decreasing stress to the best of our abilities, and doing some exercise, then we're able to bounce back from injury better, right? And so movement is extremely important. Oftentimes our physical therapists can help people get started with some type of exercise plan. Nobody's saying you got to go run a marathon from the start, but certainly doing a little bit each day can make a big difference and add up to huge gains. So getting some type of movement and exercise in at least 3 to 4 times a week can be extremely important, not just for your physical and cardiovascular health, but also specifically for your brain health. Sleep. Now, this is a tough one, right? So many of my patients say, Dr. Mitzi, I have so much trouble sleeping, right? Or they come in and say, hey, Dr. Mitzi, I'm having fatigue, I'm having trouble thinking. And my first question is, how much sleep are you getting? And they say 4 hours. And I was like, well, honey, I can't think straight after 4 hours of sleep, and I don't have MS. Okay. So sleep is extremely important. Developing a sleep routine and developing what we call sleep hygiene can be very important to your brain health. There is a system called the glymphatic system. Yes, you heard it, not lymphatic, glymphatic system. And that's the system through which the brain clears, all the junk and toxins that it accumulates throughout the day. And guess when that system works? When you're asleep. And guess how many hours of sleep you need for the system to work adequately? At least 6, okay, on a regular basis. So developing sleep routines is extremely important. And here on this graphic, which I like, they have some things that may interrupt your sleep, right? So drinking coffee late in the evening, sometimes drinking alcohol in the evening can interrupt sleep. Doing hard workouts late at night. Of course, scrolling on social media, right? Because that blue light wakes the brain up and is telling the brain, we need to be active while you're laying in the bed when you should be trying to go to sleep. And of course, doing things like watching television, also the light stimulates our brains to become active when we should be trying to rest. What are some healthy habits to develop before sleep? Well, maybe some easy reading, okay? Maybe not a horror novel right before you go to bed, but maybe some easy reading before bed. Meditation practices can help relax and calm the mind. Maybe eating a little healthy snack before you go to bed, like an apple. And then developing a daily routine of times that you go to bed and times that you wake up, and trying to stay close to it, right? Nobody says it has to be exactly the same time, but in the same range. And then, of course, a comfortable temperature, right? And if there are issues that may be interfering with sleep, like things like sleep apnea, sometimes it's also helpful to see a sleep specialist and have sleep testing done to make sure that none of those conditions are interfering with your sleep. But sleep is extremely, extremely important to optimal brain function and to maintaining your brain health, as well as building up that reserve, right, to combat injury. So kind of final thoughts, right, are that it's important to take control of your health, right? So you're doing programs like this, learning about your diagnosis and treatment options, understanding your treatment plan, participating in that shared decision making, and sticking to it, right? So you and your doctor come up with that plan, stick to it. And if you're having trouble, reach out to your healthcare team and let them know so that you can adjust the plan. Don't just stop doing it and disappear, okay? Also incorporating those brain healthy activities, such as a healthy, well-balanced diet, exercise, stress reduction, and adequate sleep can really make a difference in how you do overall. And then making sure that you have your support system. That social interaction can also make a big difference in how you do in terms of keeping your mind active and keeping your body active, etc. The last one, I always like to say, the second to last, ask for help when you need it, is a big one, because this certainly can be a game changer for many people living with chronic conditions like multiple sclerosis. Realizing that there are people that want to help you, but don't be afraid and don't be too shy to ask for help. And then finally, remembering that you are your own best advocate. And so again, attending educational programs, advocating for yourself or for your loved one if you're a care partner is extremely important to improving, decreasing health disparities, as well as improving health equity. All right, this is how you stay connected to me. I am the Nerdy Neurologist on all social media platforms, and I'm always honored to work with Stuart and the MS Views and News family. I've been working with them a long time, but these are some other venues through which I also provide education. And finally, my last slide for every talk is all I need is peace, love, and a freaking cure for multiple sclerosis. Thank you guys so much for taking out your time this evening. I know that evening time, dinner time is precious and valuable. And I hope that you got something out of it. And for those who will be viewing remotely, I hope that you got something out of it too. So I will ask Stuart to come back up. I am 33 minutes in, so not quite 35, but 33.
That's good. That's good. I thought you said 40, but 35 and 30 is good as well.
Okay.
You spoke faster than normal. Maybe that's why.
I probably did. So
you were like flying. You were buzzing.
I was buzzing. I thought I was going slow.
No, you were not, but that's okay. It's you. I understand you. All right, and hopefully the patients understand you as well. So we have a person online asking a question, then I have a few that are offline, and who knows, maybe we'll get more. She writes, or he writes, there is an MS study. What role should there is an MS society? Sorry, what role should they be playing?
Oh, yeah. So that's an excellent question. I mean, so I can't speak to, well, I can't necessarily say what they should be doing. I don't know that that's my job. But certainly we do have multiple MS foundations and societies. And oftentimes they do slightly different things, right? So, there was a time when many people or many of the organizations were doing overlapping things, but they kind of came together and formed the MS Coalition and decided, who was going to kind of focus on what. So the MS Society, the National MS Society, does a lot of work focused on research, trying to find innovative forms of research to help us to find a cure for MS. There also are some patient programs that are involved, but one of the big goals is research. We have, of course, MS Views and News, which is very education focused, and is also a patient-run advocacy organization. We have also We Are Ill, which is another organization for Black women with MS that is education focused. And so I think if you go to these different areas, you'll see who's focused on what, but each of them kind of have unique things that they offer, and I tell people, of course, the reason we have so many organizations is because there are different needs that need to be met. So fortunately for us, we have Stewart, who really kind of spearheads education that just brings it home to the patient voice and to talk about things that, often people want to talk about that we may not hear about in some of the larger venues.
Thank you so much for that. I need you as my spokesperson.
Yeah, man. I'm a Stewart fan. You didn't know?
Good. You're good. You're very good. Okay, great. So, yes, the National MS Society does primarily focus on research, and God bless them. I mean, we wouldn't have so many of the things that we do have if it weren't for their initiatives of making sure we're finding these new boundaries, these new frontiers. All right, and they're now heading up the global initiative for global research, and which is awesome. They're helping to put together the pieces. So because each country has their own laws of what they're allowed to disclose.
Absolutely.
So like the United States, we got HIPAA. So it's our research studies here cannot reveal how people are responding to the studies that are going on in the United States. The same thing goes for a lot of the countries. They can't, but they're trying to find a way to make it so that way maybe it could be cloud-based, or something else. I mean, there are a lot of ways that they're looking at it right now.
Yeah, I think the other thing that has really been a big push through the MS Society and some other organizations is to focus on progressive MS. So
Right.
we talk about unmet needs, right? I talked about different populations, but treatments that really affect progression in MS is still a big unmet need. So there's really a focus to try to see how can we stop progression. And so that again comes back to that innovative research, investing in those younger researchers or folks who have ideas that may be a little bit outside the box, that a big company won't fund, but a society, would potentially fund to see if ideas pan out.
So I'm glad you brought that up because I interviewed Dr. Timothy Cutsey, who only wants to be known as Tim Cutsey. And, I've interviewed him a lot over the years. And we did this at the beginning of November. And the topic was the global initiatives. And he brought up about the Progressive Alliance that they have. And the reason for the Progressive Alliance is because of progressive MS. And that Progressive Alliance goes around the world. And it's because, so many times we're doing studies and it's only for people with relapse remitting. And there are things discussed at conferences that are only for relapse remitting. Well, what about those, though, that are progressive in one form or another, and how, much more is needed for that? So that's what they're aiming to do.
Yeah.
All right. So let me hit you up for a couple of these other questions that I have.
I'm ready.
You were talking about diversity and the clinical trials. And so question I have is, how diversified are the clinical trials, like percentages of Caucasian versus Asian versus Black versus Middle Eastern versus?
It's bad.
What are we doing? What are we doing to get the lower numbers up higher?
Yeah, so there's not much diversity in our clinical trials, so, there's a lot that goes into clinical trials and picking locations. Most of our trials, the vast majority of patients are usually from Eastern Europe. So that's for most of our MS trials. Obviously, there's a high incidence of MS there. But as you said, just like there are different regulations in different countries, there are different regulations for people to be included in trials and different, criteria, et cetera. So by and large, the enrollment of Hispanic Latino populations in our global MS trials has averaged less than 7%. And the enrollment for Black and African American patients is usually less than 10%. But honestly, if you go listing each trial for most of our major medications, you're more like 1 to 2%, maybe 3% tops. There was one trial for one of our oral medications that had 6% enrollment of Black and African American patients. When you talk about Asian patients, it's 1%. Native American patients is like basically 0. So, there's not a lot of information that we have about these populations because the enrollment is so low. So what is being done? Certainly there is a big push by the FDA. They have actually released guidelines that are mandating that companies have a diversity plan when they try to file for a clinical trial now. They have to have a diversity plan to try and show how they're going to have a representative population, right? Because ultimately we want our research populations to be reflective of the people who actually get the medicine in the real world once it's out in the real world. For our current MS trials that are kind of enrolling now, this probably won't make a big difference, but certainly for future ones, it will. But I don't think that it will affect, to be honest, most of the trials that are currently in the pipeline.
So being that the United States now is probably a lot less white, I'll say, than the rest of the country. All right. I mean, there's a tremendous amount, obviously, of Latin Americans in the United States. Yeah. And how is this going to affect the trials going forward of future medications to come out in 20 plus years from now?
Yeah, I mean, so hopefully we'll have more diverse populations, right? But I think there are a couple of key challenges, right? One is that with clinical trials, they tend to be done in certain areas. So only certain people have access, right? Which is why we get the same types of people in the clinical trials. You get the people who have access to your big academic centers, but you don't necessarily get folks who are in the community. And many people with MS are treated in the community, right? Everybody does not have MS specialists. And there are some areas that are actually neurology deserts. So a lot of folks are being seen in the community, but the trials are not being done there. It doesn't matter how many people are in the population, you're missing them because you're not going to where they are. But I'm hoping that, the increase in diversity of the population will raise awareness. And, there are also myself and many others who are speaking to sponsors for trials and saying, you got to go to where the people are. If you want diverse populations, you can't go the same places and expect different results. So that is slowly, I think, taking root, but we still got a long way to go.
Okay. Thank you for that. Next one, during COVID, there was a lot being done by the pharmaceutical industry for providing more on programs regarding diversity, and they have since disappeared.
Yes.
How do we bring them back? I mean, MSU News is doing this, but we don't know about anybody else except for you all doing it as well. So how do we bring back more of this and get more people interested in even watching?
Yeah, I mean, one of the difficult, so a couple things. I think one of the difficulties is number one, during COVID, everybody was in the house. Now people are out and moving around. But honestly, it's also sometimes difficult to get people to in-person programs. I mean, so, I think that that certainly is a challenge. I think that, again, continuing to encourage people to recognize the importance of education, is extremely important. But it definitely is a challenge. I think in terms of DEI initiatives and focuses on diversity being done at a broader scale, there's been a really big pushback that is anti DEI. So some people are tired of hearing about it. They don't want to talk about it. And that is reflected in the fact that there are not as many programs. I think the other issue is that, in some cases, I'm not a political, guru or anything like that, but with some of the changes in laws, particularly with the Supreme Court rolling back some of the affirmative action things, it actually affects institutions' funding. So they actually could be penalized for doing certain types of work or having certain departments or having certain types of programs. So I think that that is also part of the reason. So some people want to, but may be penalized or have funding or things taken away from them if they do.
Okay, thank you for that. Next, sleep. You
Yes,
said that you should get 6 hours of sleep.
at least. It's
Is
hard.
that all in a row?
Yes.
What happens if you wake up a lot?
I mean, so, I mean, I can't say, oh my God, if you wake up 3 times, your glymphatic system is not going to work, right? Obviously, oftentimes people wake up to go to the bathroom or things like that. But as close as you can get to 6 uninterrupted hours, the system works more efficiently, right? So think the same way if you were trying to mow your lawn, right? And every 5 minutes you had to stop. Like you might eventually get the job done, but you're definitely not going to be as efficient and you're probably going to miss some stuff, right? If you got to get up every 5 minutes and stop and start and stop and start and stop and start. So you can think about the system the same way, so it's not going to be as efficient. It's not going to work as well if you're not getting somewhere in the ballpark of 6.
Like when I sit at
Close
my
to,
desk to get something done, I got all these interruptions, and the thing that I started at 8 o'clock this morning still isn't done.
I know, I
Right.
know. I feel
Okay.
this.
But so I don't know anybody that gets 6 uninterrupted hours. Nobody.
Six.
Um,
I mean, so what do you mean by okay, so okay, meaning like you just get up, go to the bathroom once, or you talking about uninterrupted, like you getting up every hour? Because that's two different things.
I'm talking about, well, for myself, I only sleep like 2 hours in a row, and
Hmm.
then I'm up for a little while, and then I go back to sleep, and I'm fully functional. So I
Yeah.
don't know. I don't know what it's what damage is being done to me. Oh, it's probably my stomach, but um, but what else is it doing to a person that doesn't sleep well?
Yeah, I mean, so again, you know, everybody's individual function is different, right? So you always know that this is, kind of what is supposed to be the best working, theory. But there are people who fit on both sides of that. There's some people who need 8 hours for it to work right, and maybe some people need 5 or 4. But
Right.
generally, sleep allows several things. So it allows that system to work to clean up, debris and crap that you accumulate throughout the day. Also helps you to lay down memories, right? As well as to, kind of solidify different things in your brain that you may have learned throughout the day and other things, and also get rid of the things that you don't need. So, could I say you're causing brain damage specifically by not sleeping? I can't say that. But the better quality of sleep you get over time, the more efficient your brain is able to function generally, right? So it basically is allowing your brain to be more inefficient if you're not getting, regular sleep.
Okay. Does that include people who have to use medicines to get them to sleep?
So it depends on the medicine. There are some medicines that don't allow people to really get quality sleep. It kind of knocks them out, but they don't feel well when they get up. So again, at the end of the day, without sleep, we die. So we've got to get some sleep. But I think it's important to work with your healthcare team, because sometimes there are other things that need to be done. Sometimes there are habits, right? That sleep routine, just like we have a morning routine. You wake up, you brush your teeth, you wash your face, you make up your bed, right? Sometimes we have to develop a sleep routine, and we just get into really bad habits, and they seem to work for us, but it's habits. And then other things that it's important to make sure that we're ruling out conditions, right? Some people have sleep apnea, other sleep disturbances that need to be treated or addressed, and that's why they're not sleeping. And then for some people, it's their MS symptoms, right? If you wake up every 2 hours because you got to pee, then we need to work on that so you don't have to wake up every 2 hours to pee, So it's really multifactorial, but I think trying to make sure to the best of our ability that we're addressing any potential barriers is extremely important, because that lack of sleep, it catches up with you eventually.
That's why we need to fly more often so we could sleep on the plane.
Yeah, I slept on 2 planes in the past 24 hours, the whole ride.
Yep, I know about that. All right, well, that's it. We're out of questions, so I'm going to call it a wrap for tonight. And I do thank you for being online with us, and we'll definitely share this with the community as soon as we can. All right, and for those that are online, thank you for being here. And please tell your friends with MS what they're missing by not being here. Okay.
Right.
All right. And again, we want to thank Genentech for sponsoring tonight's program. And we're going to say good night, everybody. Ciao.
Good night. Thanks, Stuart.
Thank you.
All right.